Many thanks. Now call on George Adam to be followed by Mary Scanlon. 6 minutes, please.
Officer, I also thank the Cabinet Secretary for bringing this debate to the Parliament. I think I will express my interest as a sitting Renfrewshire councillor at the moment, because I think it's quite important when many people who have been elected members and councillors, you are effectively at the coalface. We do, as MSPs, receive many of the cases with regards to some of the social work cases in our mailbags, but as a councillor you actually receive all the information, and there's so much that can be done, and it has to be 9 times out of 10 I have a situation where I try to get solutions as often as possible, but inevitably there's a time where you feel you've just got to try and deal with the issue in hand to the best of your ability. But I have to say that it's important. Hugh Henry's quite right, we have to work together, and I've liked the consensus within this debate, because outside of this chamber all people are concerned about are the service and the service delivery and how it means to their families, their friends and the users within, and also the professionals that work within health and social care, how they can deliver, because we have a lot of motivated professionals out there who want to make a difference and want to actually deliver within these places. But I think it's important that health and social care partnerships, I like the idea that they'll be integrated and accountable, and it's important as well that we actually have the public and third sector involved. I would like the idea that there be some way where the service users could feed in to the social care, the health and social care partnerships, possibly in a way through community planning groups for health and social care, give them an opportunity to actually get something in, because if someone is going to be using a service, they're only going to use it and get involved and engage if they're actually gaining and seeing something coming from the other side as well. And it's something that I think as well that you've got to look at the accountability of the local authority being involved and the elected members, and it's very important that there's the accountable officer as well within the organisation. But I think it's important that the leader of the council takes an active role in each area, because in my own area, when I was working in Renfrewshire Council, aptly led by Councillor Derek Mackay at the time, now Minister Mackay, and can I say to my good friend, all the best for the future. I'm extremely proud of everything you've achieved, and I know you're the man for the job. I will go on to the best man speech if he gives anything else in a minute. But also, I think you have to. Derek was very motivated as a council leader with the idea of to get involved with the CHPs, and I think that's why in our area the CHPs actually worked, because there was focus and direction, and it came from a political level as well. So I think we have to look as well that the current social work model works very well. There's 650,000 adults nationally dealing with a diverse group within social work, and they feel that they're being treated with dignity and respect. And I think that's an important thing. We need to remember that social work in itself is locally based within the authority, and they are the ones that are dealing with the cases on a day-to-day basis. And when it comes, they can deal within the authority when it comes to housing, various other issues for adults and young people as well. So they're dealing with difficult, challenging cases, and it's important that we can move things forward. Yes, I will.
Dennis Robertson.
Thank you very much.